a very good evening, everyone. The Igoja team that was in Imbale last week, as I promised you, I'm here to take you through how to use the sexual assault evidence correction kit, all the procedures, so that we can have a way to help the police and other legal agencies find evidence, and we help more. It will help us more in dealing with sexual gender-based violence. This is one of the kits that we use, for one of the important tools in rape or defilement. Like I said, when we are using it, you have to consider two things. Forensic, that is more in forensic evidence, where we have two types. We have biological and non-biological. So in biological examples that we have human urine, we have any body part or a biopsy taken of human body, we have sperms, we can have saliva, we can have hair from anything that is biological, from human, anything that is from human body, that is biological. Then you have non-biological forensic evidence, which include clothes, soil where the event took place, maybe a bullet or a gun. That one we don't see it here anymore, but it can help us in physical assault, and so many others that are non-biological. So please, you go ahead and you research about biological and non-biological materials in forensic evidence. So this kit, we are going to open it and we see step by step. But before we open, the kit looks like this. That is the sexual assault kit. Sexual evidence assault on its surface. It has Government of Uganda not for sale sexual assault correction kit. It has where you put the seals, where there is please put evidence seal. It has a serial number, sexual evidence correction kit, its date that was manufactured. Then it always comes with a seal, a serial number. In case you don't see this serial number, please don't take it. Then the expiry date. A kit without a serial number, it is invalid. On this side, there is where we have police station, name of police station, type of offense. Then you indicate, is it the suspect or victim? So sometimes for the suspects, for us we have a perpetrator, and here we usually use survivor. Those are the languages. So date and time of recovery, location, recovered by, description. So everything this is filled by the police. We are going to see the different steps that we are going to take in filling this or using this kit and filling everything that is inside. It has over 13 different steps that you take, or different things that you have to do for better evidence. But first, safety first, like we do in health, you have to protect yourself. 2, you have to have a clean room. 3, you need to have a screen, and then a clean Macintosh. Then you need to have a couscous spatula with you, like we are going to see on steps as we go on. When you open it, it has surgical gloves. So after seeking consent from a patient, creating a comfortable environment, getting an assistant, for example, if I'm a male examining a female, then I have to get an assistant. Have a comfortable environment, seek consent, and please make sure you have a screen, a clean Macintosh, you have a sterile couscous spatula. Cusco speculum. Like we shall see how it will help us during examination. When you open, we have the first things that you put your eyes on are the surgical gloves. You have to glove before you go in for any procedure. So the first thing that you will always see is the sexual. In the sexual, the first one is instruction guide. In the sexual assault evidence. So the instruction guide comes like this. It comes with 3 papers inside, carbonated papers. So one copy will remain with you after paying it. Another one you will put it back in the box or kit. Then another one you send it to the police or a legal place. You allow me open it and go through it. So it comes with seals. These 3 seals are the ones when you close the box are the ones you are going to use. These 3 seals that you are seeing, in fact they are 4. After filling everything, when you close back this thing and you close it like this, you have to apply the seal where it is supposed to be. For example, the first 2 seals have to come in here. This is 1, 2, you seal here. Then the other one, you seal here and you seal here. That means no one can reopen. These are adhesive seals. Once you seal, you have sealed. The other 2 seals that are inside, the 3 seals, again, they help you when you followed this paper, you again seal it, the one that you will remain inside. You followed it like this. So you seal here, you seal here, you seal here, you seal here, and again you seal here. So no one can open and changes. We use smart paper technology. For those who had a chance to immunize in COVID-19, in smart paper technology, usually you don't require a lot of mistakes, or we require capital letters. Every paper has a seal, every copy, a seal on it. In case it does not have a seal, then don't use it, it is invalid. So it says print or mark X, so we prefer marking X. So initials, this one was not made in Uganda, so it has surname only. So you can write initials. For example, I'm Kyakuwa Benon Brian. So I come here, my initials are KBB, Kyakuwa Benon Brian. My surname is Kyakuwa, so I put Kyakuwa. If I'm the patient, this is part A. Then ID number, I put there my inpatient or outpatient. Maybe OPD, this, 280. Then female, male X. I put male, my X. Then age in years, I put A. If he or she is less than 5 years, I put month. Maybe 59 months, maybe 30 months. So it helps. Then when it comes to address, we shall use village, sub-county, district. Village, sub-county, district. In cities, this is village, division, district. Let me say Kalangala Town Council. Kalangala Town Council. No, village Bugala, sub-county Kalangala Town Council, district Kalangala. Telephone number +251, or you can use 07 on. So this is part of patient. Then the patient will come, a patient or guardian, and put an ink. You have medical practitioner. So in a medical practitioner, where we have a doctor or a study nurse. So you come here and you put your initials, KBB. Then you put Kyakuwa, Benon, Brian. Then when you come here, you make the medical, you put in the medical registration number. Then date and time over. Then you sign. It has a signature part. Then you sign. So when you sign, then you go to telephone number. Then date and time of offense. You say year 2022, month 03, that is March, day, that is the date. Then hours can be 24. Hours that we use must be in 24, not 12. So 24. Then when you go down, part C is specific information related to the alleged offense. So when you look at it, you also use X in the small boxes. For example, contraceptives used in previous intercourse. So before this sex occurring, the rape or the defilement occurring, did you have contraceptives in previous intercourse? For example, if someone says, I used a condom, then you make the part of the condom. Then condom used during the offense, we need to know. Maybe a condom was used, you make an X, so it will really pass. Maybe she has the condom, maybe it will really you to guide whether to give an emergency or not to give an emergency. Then it can also really pass. Maybe we can go on the scene and we find the condom there still with the semen. Then it helps us and show other things. So there is where there is yes, no. So you specify according to what you see. Foreign materials used during the offense. Maybe dildos were used. Maybe during a rape, sticks were used, or anything was pushed in the lady's vagina. Any genital bleeding before offense? Was there any bleeding? Maybe the lady was menstruating. Maybe the lady was having a PID. Or maybe we need to call out again a scan to know if the bleeding was yesterday. Do you have an ectopic? Do you have a mist? All those ones to rule out the possible causes of PV bleeding in any mother. So any genital bleeding after offense, we need to know, is there genital bleeding? Where is it coming from? Outside the vagina, inside the vagina? Do we need to go for high vaginal swab or we need to stop outside? Then other injuries. What were other injuries caused? Maybe a cut wound, an abrasion, a laceration, a bruise. So we need to know anywhere if there is any wound, because as we go there, you will see that there is where we use measuring tape. Then there is washed or bathed since the offense. This one helps us a lot when we go to where to pick samples. Let us take an example. If someone took, brushed or rinsed their mouth after the offense, then we cannot, of course, take an oral swab. Or someone showered very well after the offense and you cannot trace the sperms, or you cannot take off the vaginal swab. When you go to number 2, this is fingernails. We have now started fingernails, evidence on patient's body. So I said when you are fighting, you can touch that someone. So the DNA of that person remains on your fingernail. So this one will come with 2 swabs. It will come with that one of the left hand and that one of the right hand. Here we are not going to cut off patients' fingernails, but you are going to use swab. It comes with distilled water or sterile water. So you wet it. So this is how it comes. You open it. It comes with these 2 swabs. It comes with a guide. Everything that I open will be having a guide here. It has 3 seals. Then it has distilled water. So these are the ones that come with fingernail swab. So in case you see, you can swab. So how do I swab? You always use this guide to remind you. So this is the guide that will remind you. The guide. You open. I'm sorry, I have very short fingernails. So you open, then you wet. So always open this one. If you have something to help you, where you place it to dry before you seal. So you open. When I open, I get my water, I wet. So I wet myself. I don't have long fingernails, but some people have fingernails that are long. Then I come, this is my left hand, I swab around. I swab, I swab, I swab. So I place it here to dry. So when I place it there to dry as I wait, sometimes you can pull it out, then you place it there to dry. But sometimes I leave it there to dry because at times you can mix up anything, everything. So then then after when they dry, I close. Remember I told you everything has a seal. So I write area of correction, I say finger nails. Then I place my seal. I get out my seal, then I place on it. I place here one seal. I place another seal. I place where they have said I place another seal. That means I've sealed everything. Then that has been number 2. Then number 3. Number 3 is oral specimen. I said for oral specimen, less than 12 hours. Beyond 12 hours and someone has less than 12 hours when someone has not brushed. So how do we use oral specimen? It will come with 2. So the one of which we shall use on the gums and the sides of the cheek, then the other on the tongue, below the tongue. Yeah, those are the areas that we shall use. And then it comes with the guide. It comes with the guide. But even if you have forgotten, please you can use on the gums, then side, then under the teeth. So then again, you make sure you dry. You dry, you seal area of collection. So you have to also name here. So you name, bed number in case of admission. Yeah? Then reference number, the OPD that you are going to fill here, that is the reference. In case you don't use OPD number, you can use the police case number in case you first went to the police. Then date and hour. So date and hour, we are not talking about the date of offense. We are talking about the date of collection of this sample. So we need to be specific. Then, like I've said, around, then here, and here. Then I make it to dry. Then I place it back. I seal. Then again, I come on my tongue and below the tongue. And sometimes they add pallets. So then we seal. That has been number 3. You first wet it. You don't forget the sterile water to wet. Alright, so number 4, we are going to correct body fluid swabs. I said someone can bite me, someone can power saliva on me. During the fight, his or her blood can, in case I cause injury, can drop on my body and sticks there, pounds on the body. Then you need to do a body. It comes with 3. It is not a must that you have to use the 3 swabs. So you open it. Remember to always have gloves. You should have gloves. And explaining every procedure you are going to take to your client. So it comes with 3 swabs, then sterile water. It also comes with a guide. Please always, when you are doing, revise your guide. Revise your guide. So, like we can see here, I told you can have a bite. This one was swabbing, saliva deposited by licking or kissing or sucking. This one also can help us find the toxins, human toxins, apart from the DNA. So because we know how to do that, even human saliva, it can be toxic to someone. That is it. So it also helps us find DNA. So this one, I think the man had to bite the breast. So these are semens on below the umbilicus. These are semen. So someone is trying to remove. So you can get any blood, then you can see some body fluids between the fingers. Those are finger folds. So you can look at them. So you can, anywhere you find that it is important. So you wet, then you swab around, then you dry, and you seal. Don't forget always to put area of correction. Then that is body fluid. When I go to number 5, so number 5, we have genital specimen. Genital specimen. So in genital specimen, you have to be creative first. We have Cusco spatula. We have these babies. So imagine inserting a Cusco spatula in a 4-month baby, a 2-month baby, a 4-year-old or 5-year-old. So this one will be too big. You will be causing more harm. So they are what we call ethical principles. You have to always, when you are doing, you have to consider those 4 major ethical principles. So you apply them and you see what benefits. You cannot insert a couscous in a young baby. 2, I don't have genital bleeding. No, vaginal bleeding. I'm sure, someone tells you I was not defiled, or someone, I was not raped. Those are adults. For sure, he's saying the man was just attempting, kissed, we fought, we did what? Sometimes it's not good to go ahead and we do a vagina and even insert a couscous, because you are doing nothing to this person. So ensure to know when and how to do it, when and when not to do it. When to do it and when not to do it, ensure you have those 2 things. You don't just say that every woman who comes you do a high vaginal swab, everyone who comes you do a cervical swab. So from your history and everything, you need to do those things. So there are 3. One of them will be used on the outer part, labia majora, including labia minora, then the pubis mos, the outer part. Pubis mos, labia minora, labia majora, labia minora. Like I said, you work, one of them will be used on the outer part. So the pubis mos, we shall go to the labia majora, you can swap around, then the labia minora. This is the outer part. Then these are deep vaginal swabs. When you go inside, those are deep vaginal swab. Then the other one you will use your couscous. You open up very well. Then you go and you do a cervical swab. So whenever you should put in mind one thing. For the first 2, we wet them. The outer genital area, and the vaginal swab. But for the cervical swab, we don't wet it. The deep cervical swab. The cervical swab, we don't wet it. So it will also come with the guide. It also comes with the guide, like the ones I've been showing you with sterile water with 3 things. So this guide will help you when to know and how to use it. Don't just use. So I get my first one, I wet it. So when I wet it, I come, I swap around. If I've seen anything like spam, you can swap where you have seen anything, spam or any fuel. Then I come. So I can use the first one. Two, I get another one, I wet it. So you place it inside the vaginal walls. You swap, then you place it to dry. Then the other one, using your couscous spatula, I've said mind of the edge, then 2, mind of the dangers, and how to place it. Don't place it from the sides, don't do like this. So always at times engage midwives, a gynecologist during vaginal exam. They have more information and they can guide us very well. Midwives. Then you go deep. You pick samples. So that is part of genital, which is so crucial, so crucial. When to do it, why should I do it? When should I suture wounds? Should I first take off samples? Should I first suture wounds? So it will depend on you. Then this is anorectal. So for anorectal, it comes with 2. The one outside and the one for inside. Then for anorectal, please don't put a couscous in someone's anus. For anorectal, we don't use anything to dilate the anal opening. So for anorectal, like you lie the prone knee chest position. You place someone in prone knee. I can't show it to you, but you will already see. This is the prone knee position, prone knee chest position. The prone knee chest position is what we use. So you have the one that we use around the anus. So the one that we use around the anus and the one that we push inside, the deep anal swab. So please don't use any strand today. Then you see. Then when you go to number 7, number 7 is again patient evidence on patient's body. So far we have had 3 types of evidence on patient's body. There is one that I used on fingernails. The other one I used it on what? The other one I used it on any body fluid. Now we are saying another evidence on patient's body. Here I have matted air. So matted air, that one can mean a body fluid falling on any air. So for matted air, when the sperm falls on maybe a lady's hair or saliva of a man falls in a lady's hair, then you cut. It comes with scissors. It comes with the pair of scissors. As we shall see, it comes with 2 combs and the pair of scissors. So we shall look at different debris and pubic hair. So on matted hair, it comes with a pair of scissors. So on matted hair, you cut, then you place the hair you have cut on this white paper. Please, you should have gloves with you. You should have gloves put on. So then after you close and you place inside this envelope. It is paper made. Don't place in any polythene made. In forensic evidence, we don't place in polythene made things. So you put patient name, ID, number, then contact number of the patient, then you seal. You seal, you remove this, you seal. Then after even sealing this, again you get 1 seal. After sealing it, you reseal using this one. the evidence seal. You place it one here. Then that one you pack. Then there is what we call foreign debris. You make her raise up a bit. You place the white paper below. Then, this is foreign debris. Then you comb. You comb. You comb. So you will see that some pubic hair or anything else foreign debris will fall off. Not pubic hair, but foreign debris. Even if you see nothing, you have to just close. Either with a comb, or if you don't want, you can remove it. That is foreign debris. You place it. Then you pack it in an envelope. Then you seal. You label it, you seal. Then you go to foreign hair. Foreign hair, then you comb. I've told you it comes with string. Raise a bit. Let her sit on it or lie on it. Then you comb. Looking for my other comb, but you comb for pubic hair. Because maybe the man's pubic hair had to fall on her. I think this one is evidence. When you are bathing and you have some pubic hair, at times it goes off. So during maybe friction, the pubic hair of the male had to fall on a woman, so you take off. So I've told you, like when you're bathing and your pubic hair remains on soap. So it is the same way during that process. Then you close. So it helps us a lot. This process, I've told you, it will help us LSA workers. We should not wait for big people to come and fill our forms or help out. We need to help each other during this session. Then we can have number 8. Number 8, we are going to have clothing correction. Maybe I was right. Clothing correction. Correct panties, tampons, or what we call the sanitary pads only. So when you are collecting clothing at first, please collect panties. You see, when during rape or assault, it is automatic. You cannot rape on or defile on a knicker, so you have to remove. Though it is automatic, someone may be touched on the knicker of a woman. So we need to take off that knicker and we shall find the DNA. Then sanitary pad, maybe they touched on the sanitary pad. Remember, I have said someone can defile you or rape you even during period. So we use them. Or these are the bikers that people use, the so-called, I'm borrowing that name, those underwears that they use. You correct them, simple, you correct them, and you place them inside this paper. So it is also our work, the LFA workers there out, to go out and tell these people, in case you have removed your clothes, don't pack it in a polythene. Pack it in a paper. You come with the clothes or a pant or underwear packed in a paper. But it is good, we are advocating more on coming minus bathing and removing those things. But in case someone is very, very far, and they cannot actually maintain those clothing, they own knickers. In case they did it unaware, let them place them in a paper or polythene. So that is very good. Then you seal. Don't always forget to use this seal and you seal it. Number 9, we are going to look at foreign debris. Foreign debris on this person. So remember, when you hug someone, probably, then you assume you hug someone with a fume, it remains on you, a fume. I'm giving an example, I'm not saying they are going to hug. So it is the same thing when you hug someone, or when you have sex with someone. Maybe the chest hair, maybe the anything will remain on that on your body. So what we do, it comes with a big white paper. I unfolded it. I lay it on a clean ground. So I unfold it. The one doing it, I unfold and stand on it and jump over it. The one doing. Then she can undress. He or she can undress and again jump on it. You undress, you jump on it. So after jumping on it, even if I see nothing that has fallen on, I just fold it back. I just fold it back slowly. I fold it back. I make sure I don't lose anything. This is number 10. So in number 10, we shall have a reference blood sample. So what happens with the reference blood sample? So a reference blood sample, we shall see it. Reference because we have been taking the different samples for DNA. So we need the reference. We need the DNA of the survivor to differentiate it from the perpetrator. The survivor, you can call her a victim, but in this case we don't call defiled or raped or ladies that have gone under sexual harassment or any form of sexual unwanted sexual activity victims. It sounds weird, so we call them survivors because they have survived. So we need to create a good one. So you come on your, we always prefer the hand that this is done by most of the laboratory personnel, but I think every health work is trained to take over at least a blood sample very well. So on the left, use the arm of a person. If right-handed, use the left. If left-handed, use the right. On the tips, probably we prefer this or this. These are the areas. So you swab it very well. Come with the swab. So you swab very well that hand, like here. So this is FTA card. We shall take off 2 samples. This is FTA card. So you take off samples, you make 3 big drops here. For the health workers, the same way you have been taking off the viral load, but it was changed. Now viral load you are taking a different way, but the other way we used to take off the viral load. You dry it, after drying you insert it. Patient's details should be placed there. Then you seal. Like I've said, everything comes with a seal. You seal it. You seal here, 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 here. You make 3 seals. Alright, when you go to number 11, we have hollow blood sample. So hollow blood sample, you can take it from the vein. You're using your test tube, a purple top. Not a test tube. Sorry. You are using a vagutainer. A vagutainer that is purple top. It is what you use. So you take off hollow blood of the survivor. So the last one is a measuring tape. Second last, it is a measuring tape. So why do you have a measuring tape? So during filling for this form, at times it's where you will find wounds because you have to examine this person fully, not only vaginal exam, fully for anything. So when you go there are what we call on examination wound edges. Wound edges, depth of the wound, everything. So you use this measure. Let me say I have a wound. It also has a direction. I have a wound here and my edge is here, so I put it there. You will see to have length time with the width, the way we used to do it in primary. when you put at any edge, then we see. Then sometimes you need to use your fingers to estimate the depth. So please, if you are not covered with estimating this, consult a surgeon, a senior medical worker, a person you feel like is good at wounds. So examine the wound size. So it helps us know the wound size. Then this one, at times you take off slides, dried sample size you have to pack in this envelope. So after that, you step of filling the forms. So you fill the forms very well. So you go back, we fill. Remember, we fill everything using, I told you it is a smart paper technology. Use X, not a tick, capital letters. So you mark where you have filled. So foreign materials, where did you take the foreign materials? Blood sample, then you make sure that copy will go to police. This one will go back to the box. Then one to the police. Then you put everything back to your box. Then you seal it. That means not even someone else can open it after sealing it. So you are sure. So whenever a person comes, survival of defilement, survival of any sexual abuse, be it which type, and you feel like I should use the evidence kit. These kits are available in different government health facilities. If you don't have, you can consult the police. Then the police can have another type that does not involve this, but again it will involve almost what is to use. Health workers are fearing to fill it. Please feel free to fill it. Again, you fill it. It is always at health facilities. Fill it as you wait for someone to go to police, or the police, to involve in police, you wait, you get your own police form, then you fill everything. You help them, you direct them. Otherwise, this one is for health workers first. You are not filling a police form, you are not doing anything, but you are helping, you are filling as you are treating. Then a victim of sexual assault is an emergency. So they should not always wait in lines or what, they should be protected. Same to other victims of SGBV, other victims of sexual gender-based violence, be it psychological, be it physical, or be it sexual. That's how we can help and we can improve. For more information, we shall get you the email and others. Then too, the more you fill the police, the more you, not the police forms, the more you fill this, the more you are helping the nation, the more you are helping that survivor to get justice. And the more you are, this kit actually is going to help us reduce more of sexual assault cases in Uganda and in every region if you use it. Thank you so much.